So just for interest of time, we're not going to have everyone introduce themselves, but if you could still put your name in the chat, your pronouns, the organization you're representing, and we'll just do a quick introduction of the Vital Connection staff that are here. So I'll start. My name's Mary Olseth. I'm the project manager at Vital Connection, so I'll be working really closely to support all the community partners on this project. And yeah, I'm currently in JP Boston. I'll pass it over to Marianne.
Hi, my name is Marianne, and I'm one of Vital Connections Health Equity Scholars. I'm a student in college, and I help part-time with projects like this.
Ariel.
My name is Ariel Childs. I'm the executive director, sorry, here at Vital Connections. I'm so excited to see all of you. This is going to be so fun. So, and I'll pass it off to Mariana.
Hi, everyone. I'm Mariana. I am our deputy director here at Vital Connections. I am really here to provide some support in Spanish if anyone needs it. So I'm going to introduce myself in Spanish in case anyone here needs not translations, but answers in Spanish. I can't do live translations. That's beyond me. Buenos días a todos. Me llamo Mariana. Soy una de las directoras acá en Vital Connections. Yo estaré disponible en el chat si alguien tiene cualquier pregunta o cualquier duda. Pueden ponerla en el chat durante la conversación o levantar la mano y yo estaré disponible para atenderlos. Gracias.
Thank you so much. And I will ask if everyone could mute themselves for right now. We will have time for Q&A at the end. But I'll maybe mute a few people too if great, thank you. So we'll have a full hour meeting. So we're going to do a brief introduction of Vital Connections if you're unfamiliar with our work. And then we're going to do a project overview and share a little bit about phase 1 of the project and key learnings from that, and why we found it was so important to do phase 2, what we're entering into now. So then we'll go over this project and how it's a little bit different than our previous iteration. And then I'll spend some time going over the request for proposals, the application, if you have any, go over those details a little bit more. And then we want to save time for questions and answers. And so if anything comes up, please put it in the chat so you don't forget. And we'll have, because we want to make sure we answer all the questions you have. And I know there were some questions you all sent in the Zoom registration. So hopefully we'll get to those. But if not, please ask them again. And I'll pass it over to Ariel to start.
Excellent. Awesome. Well, like I said, this is really exciting for me. A lot of you are familiar to me. I come from the maternal health space before my career here at Vital Connections, and I'm just really excited to be in this community again. And this project has been a bright spot for us here at Vital Connections, and we're super excited to build upon the success of our first phase and really build it out with a new set of partners moving forward. So like Mary said, we're going to take a moment just to share about Vital Connections because this may be your first introduction to our work for some of you. And so we were founded in 2020. We are a health systems change organization dedicated to advancing health equity. And we were really founded in response to what we call the Boston paradox, that this tiny city is overflowing with some of the best healthcare in the world, an incredible network of community-based organizations, and really remarkable community assets and community leadership, and yet still is grappling with persistent health inequities. The data really hasn't improved, and in some cases, it's getting worse. And so we know that these inequities are rooted in systems of oppression and really require a systems change approach for a solution. So we really see this paradox as both a reflection of these systemic inequities, but also an opportunity to do things a new way and to reimagine sort of a more liberated community health ecosystem here in Boston. So our mission is to partner with community stakeholders. And whenever we talk about community, we like to be really clear that what we mean are other community-based organizations, community members, community coalitions, to create a more equitable, effective, and efficient community health ecosystem. And so we have developed an approach called our community-led systems change model. And that is what we apply to all of our work, regardless of the content area that we're working on. And that is really rooted in assessing community assets and needs. We are always wanting to build upon what's already working well, and we also want to fill gaps that are prioritized by our community partners. We also convene folks across sectors to advance collaborative initiatives using resources that already exist. So we believe that we already have what it takes to advance health equity. What's missing is functional ways for those things to work together and collaborate and coordinate their efforts. And so, one of our previous board members used to say that silos are for corn, not for transformation or liberation. And that is our guiding North Star. These inequities don't exist in silos, so the solutions shouldn't either. So that's a really core piece of our work. The other core piece, and probably most important, is the ways in which we cultivate community-centered strategies. So community stakeholders, as I defined before, are involved in every stage of our work, from deciding what we focus on, how to design collaborative initiatives, implement those initiatives, evaluate them, and then share out those learnings. And that can look like it takes different forms, but we have community member peer advocates, we have community leadership positions, which are paid positions for community members as part of our Vital Connections staff. And then we have a number of initiatives that create spaces for bidirectional dialogue between larger institutions and systems of care, and the communities that they are trying to support. So moving on to the next slide. In 2022, the new Commonwealth Fund for Racial Equity and Social Justice received a $2.5 million grant from Mass General Brigham to address maternal health equity. And we stepped in with them to sort of spearhead this project. It aligned really well with our model, because at the time, there were quite a few new options coming on board that we knew had demonstrated success in addressing maternal health inequities, such as Boston's First Birth Center, Medicaid coverage for doula care, new certification licensures for IBCLCs and CLCs, and that's lactation support. And so we saw all of these things coming online that we knew would be really important to connect Black and Brown, low-income, immigrant, queer, marginalized communities too. But we also knew that for decades and decades, these things had been exclusive and there had been no access to these things. And so there was a lot of community-based curiosity and questions and some fear around, what does it actually mean to gain access to these diverse maternal health options? So we stepped in and developed a community-based approach to spreading information about these diverse birth options, including birth centers, midwifery care, doulas. Specifically, those were like really in our focus for this project. And to work with trusted community organizations and local businesses to host community conversations that could spread information and awareness, but also help us learn more about how community members are thinking about maternal health and healthy pregnancies and healthy births, and then to bring that information back to systems of care and other healthcare institutions for systems improvement efforts. So in year one, we piloted these, actually go back quickly. Yeah, year one, we piloted these conversations across 6 trusted hub sites. These were sites that were identified as just having deep community trust, and also that had historically not been included in conversations around maternal health. And so we'll get into who that was, but it included Spanish-speaking immigrant women, young boys between the ages of 14 and 18, youth generally between the ages of 14 and 21, Black moms in Dorchester, Black and Brown moms in Dorchester through the Epiphany School, and educators through the Teachers Lounge. And with these partners, we co-designed conversation guides around maternal health, which we will tell you about, and trained community members as co-facilitators, and had these sites implement these multi-part series of conversations, again, to spread information and awareness, and also learn from the conversation as to how we need to improve things within the maternal health ecosystem. And so now we are taking all of our learnings from those conversations, leveraging the things that worked really well, addressing the challenges that we learned from, and then figuring out where opportunities existed to enhance those conversations to make them more effective and accessible, and really like conveying the information that community members deemed most important. And we are ready to replicate and scale them with new partners and across additional sites. And that's how we have reached all of you. So like I said, we're going to take some time to walk through phase one of this pilot because this project can be somewhat abstract and we really want to bring it to life for you, not because you have to do exactly what happened in phase one, like Mary alluded to, there's going to be some changes, but because we want you to really be able to imagine the possibilities that could exist in these conversations and in this project, just to get your wheels turning as you prepare to respond to the RFP. So again, in phase one, we piloted with 6 sites. I already went through the communities that we were working with across those 6 sites. In the end, we reached 60 community members and trained 20 co-facilitators. And every single site followed the same conversation arc, but they did it in different ways. So every site went through sort of unpacking their own birth stories or their stories of origin if they didn't have children, discussing what they felt they needed or their community needed for healthy pregnancies and births. And so that's what we talk about when we talk about someone's mental model is like, when we say healthy pregnancy, what do they think of? Do they think of prenatal care or do they think of church or do they think of housing or do they think of their community and their social network? We then sort of got a temp check on the current state of maternal health here in Boston and then more broadly in Massachusetts and in the country, specifically Black maternal health. Then all the sites visioned around what liberated birth might look like in their communities. And then we took some time to figure out like, what is our collective narrative around this and what is each of our roles in advancing our visions forward. And I'm going to show you some examples about what this work looked like, but I wanted to call out some of the activities that, you know, like I said, we were working with young boys, some of them as young as, 14 and 15 years old. So coming and saying, what do you think of when you think about maternal health was not going to be an effective strategy. And I was really like curious as how would we convey meaning in these conversations and make this relevant. And so we worked with an organization called Young Man with a Plan, and they developed the most powerful and incredible curriculum that used music as a way to connect with young men. So they would listen to these songs and pull out from these songs what made them think about healthy pregnancy and healthy birth. Then they would write their own lyrics about their own birth story, whatever they've heard or haven't heard and what that makes them feel. And then they wrote lyrics for their future child's or their sister's future child or whoever's future child. That aligned with their vision for liberated birth. And so through this way, we were able to understand what was most important to them when thinking about healthy pregnancies and births and what we really needed to do for the ecosystem to respond to those needs. Other examples of activities included journaling, collaging, poetry, role playing. We did lots of gallery walks with newsprints. So this was all part of the co-design process where we brought in sort of, here's the information that we need to get through. And then our partners were able to say, here's how we're going to deliver that information and learn from our participant perspectives. So these are just a few examples of some of the work that came out of the groups. I'm going to read some quotes too. These are all from participants. So this was a reflection from a birth story. My feeling was I was very dignified. I yelled, but in silence. And these are collages that they made about visioning liberated birth. And you might see that this young woman, I think she was 15, put a check in the middle of hers that said maternity reparations for Black women. And I just thought that was so powerful. And those are the kinds of things that can come out of these creative activities. This picture shows sort of the work in action. So people doing gallery walks on the right side of the screen, answering prompts and questions about maternal health and healthy births. And then on the left, people working on their collages. And another quote from Reflections from a Birth Story, all I felt was fear of pain and not being able to do what I felt I was supposed to do. These are some more collages. It was hard for me to speak up and name what I needed at one point in my life, but I switched that and I never stop now. And again, we just wanted to share, these are some of the newsprint activities. So we said, what do you think of when you think of the word birth center? Or what do you think of when you think of the word hospital? Or what do you think of when you think of the word midwife? And somewhere on there, someone wrote when there's, this might be on the next slide too, but when we said, what do you think of when you say the word birth center? They wrote, I am free, which was just also like so powerful and allowed us to really think about, okay, how do we share that message with other community members? This is, what does a healthy mom need to know? What does a healthy mom need to believe? And what does a healthy mom need to do? So we're always thinking about like the head, heart, and hands, and how do we think about people's mental models in that way. And then one more quote was, I felt during my birth story, love, strength, transformation, pain, and empowerment. I started with my mom's story. I started with my birth story in my mom's womb. I didn't know I would have the strength and courage to change the story and generational curses. And we included that quote because that came up in almost every single conversation, that people's narratives around healthy birth and pregnancy and their mental models around birth really start with their own birth story, their own story of origin. And this idea of breaking generational curses with envisioning a different future for their own children or their future children or their community's future children was something that came up again and again and again. And so what we learned from these conversations is that the conversations have the potential to impact the utilization of these diverse birth options in the following ways. So first of all, what we learned is that people really need to believe they are deserving of support. These conversations were able to create space for people to unpack their own trauma, sometimes their mother's trauma, sometimes their grandmother's trauma, right? These things are passed down from generation to generation, and really find community and connection in sharing the pain and challenges and seeing like, this is not something unique to them. This is something that has happened systemically and that they believe to have the care that they need. We then learned that once they believe they're deserving of support, they need to know what kind of support would be helpful, and also know what support is available and what to expect. And so this really aligns with the ways in which these conversations spread information, what is even available out there. And it's not just about diverse birth options. It's also about hospital births and more sort of quote unquote traditional birth options, but really understanding both, all the options that exist and who is it for and how do you access it and all of those questions. Then if they know what kind of support they need, they know they're deserving of support and they know what that support is, there needs to be community support to encourage them to use it. And so these conversations are really meant to create a groundswell, right? Maternal health conversations have often existed in the silo of maternal health care, and we're really trying to make them a kitchen table topic for community. You know, like if every 15-year-old boy knew what a doula was, think about how fast that information would spread in communities. And so, you know, really creating a groundswell in community so that everybody knows what's out there, everybody knows what might be valuable to them, and then they can make decisions for their own sake that are informed by accurate information and awareness. And from there, choosing to accept support when it's offered. I'm just gonna mute. Okay. Choosing to accept support when it is offered is aligned with what we're trying to do to leverage these learnings and sort of funnel them back to larger systems of care for systems improvement efforts, right? So choosing to accept the care needs to be aligned with your cultural values, community values, identity, lived experience, all those things. And so if someone says that healthy births to them means that they need to be spiritually sound and spiritually safe, then all these spaces need pastors available, right? And just making sure that the care that we're offering is aligned with what people need so that they actually choose to accept it. And then the reinforcement piece is, again, this ongoing sustainability. How can we ensure that systems of care are continuing to invest in and support these diverse birth options so that this shift in the ecosystem can be sustained? And I know that's like really heady stuff, but I wanted you to sort of see, we're going to like really dive into this for those that are accepted into this partnership with us, but we wanted to give you a sense of like the why behind the conversations and what our overarching goal is. And so in phase one, some of our key learnings were that participants' views on maternal health were deeply connected to their own origin stories and their children's birth stories. And these perspectives were shaped by past trauma, opportunities for healing, cultural narratives, and very limited awareness of what other options in maternal health care could exist for them. Most people had never heard of a birth center or a doula, had misunderstandings around midwifery care. So there was a lot of misinformation or lack of information out there. And so we thought of quite a few action steps, including prioritizing mental health before, during, and after pregnancy, promoting workforce diversification to align the support that's out there better with the communities that need it most. Facilitate provider engagement. So we need to do the same mental model shifting and unpacking with providers as well, so that we can unpack their biases and the ways in which those play into their care. And then better coordination across the ecosystem. So again, this does not operate in a silo, so the maternal health ecosystem needs to be better coordinated across sectors. The two that we are focusing on in this next phase are convening an advisory working group for maternal health systems improvement efforts. So that will consist of our original pilot sites, community members from each of our pilot sites, and various stakeholders from the maternal health ecosystem that have been sort of peripherally involved in this project. And they will be iteratively learning from these conversations and working together to make systems improvement changes. And then why you all are here today is that we are also expanding our community conversations using the Trusted Hub model to continue increasing awareness of responsive birth options and fostering community connection. And we know that these conversations have the power to promote individual healing, community healing, and to heal the ecosystem at large. And so that's why we have decided to really invest in this model more deeply and scale it as widely as we can, as far as the dollars will stretch. So that was a lot of information. I don't expect you to sort of digest it all right now. This is recorded so you can rewatch it. We're also available to answer questions. We'll have Q&A at the end. And then I just want to reiterate that if you were accepted as a partner for this phase 2, we're going to be digging into this again and at a deeper and slower pace.
Great. Thank you so much, Ariel. Yeah, I always get really inspired hearing you share about these because I was not involved in phase 1. So similar to you all, I'm just like getting more and more excited for what phase 2 can look like. So as Ariel shared, for this part of the rest of the info session, we'll be focusing more on the conversations that you all will be facilitating in community. Because we thought this was such a great opportunity to build upon the phase 1 learnings and the mental models that we had already learned about. And that's the main way we're doing that is through partnering with more community-based organizations, community groups, other businesses to host and facilitate these conversations. But some feedback, some changes we're making is to include more safety messaging for diverse birth options. As Ariel shared, one mental model that emerged is that the idea that non-hospital births are emotionally safer, but medically less safe. So we want to make sure we're sharing more information, technical information about how they can be both medically and emotionally safe. So how can birth centers offer emergency support? How do midwives get trained? And along the same lines, we also want to integrate maternal health service providers into these conversations to provide more opportunities for that relationship building so people can ask questions directly to the maternal health service providers. So if you are on this call and you are interested in more serving on that side and bringing that perspective, we will be holding a future meeting where we organize birth workers. So if that's you, please put your name in the chat, include your email and what type of birth work you do, because we also want to bring people in, just be able to share this information so people can be aware of all the different offerings there that exist in Boston. Another change we're making is shifting to more of the train the trainer. So in the first phase, we were much more involved in facilitation and the co-design, but we want to make sure that these conversations can happen in many different spaces at a faster pace. And so we will be providing a really comprehensive toolkit, and I'll share out the contents of that in a few slides. But you'll be able to see some examples of the conversations, the maternal health data, and we'll be scheduling several calls with you all to prepare you to kind of help craft activities and scripts to share. And so it won't be as much hands-on, but we'll be making sure you feel prepared to facilitate these types of conversations and activities. And lastly, as Ariel shared, we're forming an advisory committee. There's so many exciting things happening in the maternal health space in Boston. So I think for us, that was important because we want to make sure we're sharing this back out to different people in the ecosystem so that we can create the systems change that we need here. So we have just included some of the people that will be a part of that advisory committee that we're co-creating. So now I'll be getting more into the nuts and bolts of the RFP. A lot of this information is included in the PDF you may have seen. If you haven't seen it, we can drop the link to our website where it's included. But just going over this, it's important that you all have a physical location to host these conversations. It doesn't need to be your office space. That you don't need that doesn't have to be where you always work, but just a space that you can rent, a space that 8 to 12 community members can gather to have safe, engaging, interactive conversations. You'll need to be able to dedicate 4 to 6 hours of staff time for that pre-implementation, for the meetings with us to help design your conversation, to go over the content a bit more. We don't have those scheduled yet because we can see them being staggered as we let people into this opportunity. So we don't have those dates outlined right now. You have to have the ability to recruit 8 to 12 community members. These can be people you already work with. These can be people you have been wanting to engage for a while, and this seems like a good opportunity to bring them together. And we will provide some guidelines of how you can go about doing that or some suggestions. But the recruitment will be on the community partners to identify and bring those people in. And one other thing to note is it's important that they can commit to attending the sessions. So, some people had 5 sessions over a few months, and we were hoping that the same 8 to 12 people can attend every session to help with their relationship building, to help for them to go through the whole conversation arc. So hopefully they can commit to the whole series. And lastly, we welcome all organizations' identities, languages, and communities to apply, but we are specifically interested in reaching BIPOC women of all ages. You can be a birthing person, a non-birthing person, men of all ages. Again, we were working with young men from ages 14 to 18 before, and we find that that's really impactful too. Spanish-speaking individuals, immigrant families, teen parents, members of the LGBTQ plus community, and elderly or intergenerational groups. And so as you're even listening to this information, if you're thinking of other organizations that you think would be a good organization or community group to participate, please let us know. They can apply to this round. This is a rolling admission, so even for the next year. And so please, we want you all to let us know if there are other organizations or groups that come to mind. In terms of partnership expectations, partners will receive a $5,000 mini grant. We don't have set guidelines or expectations as to how you'll use these funds, but we do recommend that you use it to pay for facilitators or time, both in facilitating and planning, for participant incentives. If you all need to buy materials, you could see in the photos that Ariel shared that people had magazines, were gluing things, had whiteboards up. And so if you need to buy materials, food to help people gather, again, more reason for people to come together is usually meals. So those are some suggestions we have, and we can work with you all if you need support in creating a budget, but that's not a requirement for us. You will receive a maternal health community conversation toolkit, and then ongoing training and technical assistance from us. That's going over the maternal health data, that's facilitation, support and strategies, and you all will be responsible for identifying who is going to be facilitating. Maybe you on the call are not going to be the one facilitating, but you have someone in mind who's a really great community facilitator. So identifying who those people are and making sure that they are available to attend either facilitation training with us or attend the pre-planning so they're aware of what they're going to be doing. And then, of course, the recruiting, the planning, and implementing and evaluating the community conversations. In terms of evaluating, we will be providing a survey, so you don't need to come up with additional surveys, but we'll want support in distributing that. this is just an example of what the toolkit will include. We recognize that all of our partners who will apply to this will be really different. So we want to provide as much support as possible. So this can be around guidelines for recruiting and implementing, co-facilitation strategies, the content overview of the conversation arc, as well as different discussion prompts, activities, relationship building suggestions. We'll provide a maternal health data fact sheet, maternal health services info sheets, a note-taking template. That's another important piece is we want to capture what people are saying, so we can also look across the themes of what mental models people have across community partners. So having a note taker is also helpful and important. And then evaluation tools. The evaluation tool, that will be a survey for you all, because we want to learn more about what you all got from this, as well as an optional survey for participants. That's not a requirement to do a survey for the participants. So we're almost to Q&A, but just next steps. We will share out the application one more time, but please submit that. We'll be reviewing those and accepting them on a rolling basis. By January 31st, that's when we'll be reviewing the first round. And then we'll reach back out February 10th. And we'll be setting up a call with you just to learn more and ask any questions we have or answer questions you have. And then project February 21st, you'll be notified if you're selected. And then the project start date is in March of some time. And as we said, this is a rolling basis. And so there'll be future rounds of this. So we'll notify you on. I know it's a lot of information. And so I'm going to stop sharing and look at the chat because I haven't had a chance to do that. And we'll tag team with any questions. But I see, Marcia, you have your hand raised.
Ooh. Thank you so much for this information. I am very excited about this opportunity. As I noted in the chat, we are in the throes of working to build a health center in Hyde Park, and we find this to be an opportune project for us to get data. But we are a small but mighty team, and so my question really centers around logistics and resources. And my colleague, Dr. Ellen Scalise, is also here, so she'll also add to some of the questions that we have. We met as a committee a couple of nights ago and got really excited about I have some questions. So one of my first questions is, I noted that you said that as the facilitator, well, let me just ask this question first. Is the facilitator the same person as the organization that applies for the grant? Can it be? Does it matter?
Doesn't matter. It could be someone related to your organization or a past participant, a current participant, a community leader in the community, or it could be a representative from the organization. It's really about just identifying someone that's, has trusting relationships with the folks that will be participating.
Right. And so it sounds like the facilitators are responsible for getting people together to recruiting those 8 to 12 people. And I'm wondering, what is the accountability if people don't show up? What will happen if after our first group, they don't show up again after that? And by the way, is there a limited number of sessions in the series, or is there a set number of, did I ask that right? Yeah. What is the limitation of the number in the series? That's what I want to ask.
Yeah, sure. I hear what you're saying. So the way partners in phase 1 implemented the series, it was different for each site. So like I said, all the sites have the same conversation arc, and in the toolkit, you're going to have example conversation guides that you can choose to use or just adopt pieces of and make your own. Some groups did it in like a retreat sort of session, like 2 half-day retreats where they brought people in for a couple meals, and that way they didn't have to worry as much about having people come like week after week if they were worried about retention. Other folks did 3 days in a row. I would say that didn't work the best. And the other model that was used was a multi-week series with sort of smaller bites over more weeks. So maybe an hour and a half of conversation for 5 weeks in a row or so. So it's really up to the site. This project is very much in the awardees' hands in terms of how it's all done, because we trust you all to know what would be most effective and accessible. So, and then in terms of your question about like what happens if people don't come again, I think one thing we're really going to be looking at in the applications is what is your relationship with the people that you would be recruiting to participate in these? Is there already relationship and trust and community built in these spaces? And we find that if that's the case, people come back because they are in community with one another, and they're really committed to these conversations. We always say to over recruit because of course like life happens, and it's okay if people miss a session here or there. It's not something where you can like jump in the beginning and end and have it be as meaningful, but if you had to miss a session and catch folks up on the side, that would be okay, for like a one-off. So does that answer your questions?
It does. Thank you so much. I have one last question to
Yeah.
ask. So we are planning on having a health equity symposium in Hyde Park, our first to launch the discussions around building our health center. And we thought it would be an appropriate time to convene at the end of the day, convene one of these first conversations. But the timing may not be aligned with your April to June time slot. So the question is it possible that we could start earlier in March, or is it set? And yeah, that's it.
Yeah, I would put those time limitations in your application and let us know. It's not impossible. We just also want to be realistic with having our ducks in a row enough to give you the support that you need to launch successfully. So I think thinking through how many conversations you might have and how they might unfold over time if the start was earlier, it'd be good to like see the whole time frame that you're thinking of. So yeah, it's sort of a non-answer that I'm not entirely sure when we could get started earlier than that, but if it felt compelling and like we could make it work, we'd be willing to work with you to do that.
Thank you.
Yeah. I also see a question in the chat about if there's a virtual option for participants to attend the conversations. We discussed this as a team, whether we wanted to make that an option. And I think we'll welcome applications if that's the only option for you. We will most likely prioritize applications that have a physical space because these conversations sort of require that. Not, it wouldn't be impossible to create the same meaningful space online, but it would be really hard. And so I think we'd have a lot of questions just about your experience facilitating these types of online conversations and what strategies you might use to overcome those challenges. For many, these are new conversations, and they can be hard and they can be painful and they can be full of joy, but all of those things, I think are harder to invite in a virtual space, versus in community with one another. So. Abeo, see your hand raised.
Hi, thank you for this session. I guess speaking to the virtual versus in person, regarding the trainings for the organizations, would that be in person or virtual? Just to like think ahead, plan ahead.
Yeah, that could totally be virtual. If people had a strong pull to want them in person, we could also make that happen. But the partnership engagement and the training and technical assistance and all of that could be done virtually.
Thank you.
Yeah, of course.
Any other questions? We went through the content a bit quicker, so we have some more time. Marcia, you mentioned offering technical assistance, can be templates for invitations, social media support, etc. Also, when the evaluations are complete, will we access the data to use for our community work? They're really good questions.
Okay, let me just read that again because that was a lot. Yeah, I mean, I love your ask because I think once we have a draft toolkit that's shareable with the partners that we select, we would love your feedback. And if something's missing from it that you think would be really helpful, like we hadn't considered social media support. We didn't do a ton of social media outreach in our first phase, but we did do a little bit. And so we could think about how to integrate that. So my answer is that it will be quite comprehensive, but nothing is ever written in stone. So if there were pieces missing or ways in which you wanted to grow the toolkit. We try to be as responsive as we can. And yes, we always share out our data, and would also work with you to see if like you wanted to do some sort of more inclusive, like community-wide sharing, not just for your organization, but if there's learnings that you felt were applicable to wider sharing, we would help support you with thinking through that as well. So
Yeah,
yes, we would.
Ellen had a question. Are you allowed to give participants of the community a small stipend for their time and participation? Yeah, that's something we really encourage. If they're taking part in this conversation series, using some of the $5,000 grant to go to the people who are participating, in a stipend, gift certificate, or gift card. Yes.
Mm-hmm. And that can come in different forms. Again, I'll give you a couple of examples from phase one. So we partnered with a gym in East Boston, and they did complimentary gym memberships for a certain amount of time. For the retreat, it was like a self-love retreat. So the participants, this is with moms at a school. So we knew they needed some love and some self-care. And so they got gift cards and like little goodie baskets and really nice meals throughout the day. And then some of our young men, those partners decided to pay their young men hourly as maternal health consultants, really like having them step into this identity as holding important information and having an active role in spreading it. And that was really cool too, because they took it really seriously, like this new job that they had. So there's a lot of different ways to do it, but the $5,000 would be yours to spend however is most helpful to ensure meaningful participation, both for your team or your facilitators and for the participants. Couple other questions that had come up in the chat before that I wanted to make sure people saw that we addressed. People asked about geography. Is it just Boston based or can folks apply from elsewhere? So similar to the virtual versus in person, we welcome applications from wherever. We don't actually have any geographic criteria, but we will be prioritizing applications from the greater Boston area. So Boston proper and the surrounding neighborhoods. And then there was one other question at some point. I guess just about the library of information moving forward. We are like always collecting our learnings from this project and compiling them and sharing it out with existing partners and have plans to share that more widely with others as well.
If you're not sure if you could do it this year, but still want to apply, because I said it was also for 2026, do you encourage us to apply now or wait to apply?
I would encourage you to apply now if you feel ready to. If you're sort of waiting to see how you may evolve in your work and you think your application could change, then wait. But if you think the application would be ready to go, I would say apply now and put in your notes in the application what time frame you'd like to implement the conversations. Other questions? I'll also say I saw some people put their names and contact information in the chat when we were talking about the birth worker support and the separate call for that. So we will write that down. But also feel free to reach out to us too. If for some reason you don't hear from us and you're worried you missed the announcement, I think you have our contact information. We'll put it in the chat again, but feel free to reach out and just let us know that you're really interested in being considered as part of that group.
Yeah. Abigail.
More of a clarifying question. We kind of touched on this, but I just want to make sure I have it right. So if there is an external facilitator that you're tapping in from your community, would they need to participate in the March trainings, or like would you have to like know your external facilitators ahead of time so that they can participate in those trainings, or is it more of like I'm in the training and I make sure that my facilitators are equipped with the relevant information from the toolkit.
Ideally, the people who will be facilitating the training, the conversation will participate in at least some element of the facilitation training. And that doesn't necessarily have to be one person for the whole thing. So it could be like someone from Trailblazers that like gets the onboarding to the project and is sort of like the point of contact and has the training related to the toolkit and all of those things. And then we bring in whoever you've identified as a co-facilitator for the actual facilitation training itself, which is a shorter amount of time. So yeah, I would say ideally we would have some sort of touch point with them.
Okay, thank you.
Yeah, Mary Ann asked a really good question too around how much opportunity will organizations have to brainstorm and collaborate with each other in designing their programming for their communities. That's not something we've like fully thought about, but I think that's a really good idea. And that could be an optional session we hold where people can come together and share ideas or problem solve what different activities. So yeah, Mary Ann, I think that's a great idea.
And generally, when we convene folks for these collaborative projects, we always have an opportunity for people to opt into some sort of like distribution list or contact list. And so even if we're not creating formal opportunities for collaboration, often it happens organically between organizations and people who are looking for that kind of support.
Well, we can wrap up a bit early, but yeah, we really appreciate everyone joining this call. Please don't hesitate to reach out if you all have any other questions as you're applying. And I'll put my email in the chat if you have questions. And yeah, we look forward to.
Sorry, were there any questions that came in through the registration that we didn't get to? I just want to make sure who may not be asking right now.
One was around possible event topics or activities to encourage community participation. I think we touched on that a little bit around having meals, stipends, or I guess was if someone asked that question around if they're thinking about recruiting or getting people to actually participate in the series. I didn't.
That was me. I'm home with a sick toddler today, so I'm sorry. But yeah, so that was covered like about journaling and different things that we could do, like lyric writing. So I'm from Faith Christian Church. So I was just trying to get different ideas of things we could do to like discuss like mental health support, single moms, different things. So thank you so much.
Yeah. Great.
And one other thing we created and shared out, and we'll share out again, is we have a pretty comprehensive maternal health resources resource guide. And so that's another thing we'll include in the toolkit that we encourage you all to distribute through these conversations, but also just on your own time too. Oh, thank you. Mariana's quick with the blinks.
Got you.
All right. Well, I hope you all have a wonderful rest of your Wednesday. We appreciate you all taking the time, your excitement for this project and for working with us. And yeah, we look forward to connecting soon.
All right. Thank you all. Take care.
Bye.